PCT for TRT? This is a question I get all the time, and I want to break it down for you guys. Everyone knows that post-cycle therapy is really not a medical term, but it's a bro science term, but it's been out there for decades for steroid users. So if you're on anabolic steroids and you've done a cycle or more, you do your PCT, right? But I don't recommend that because there's really no science behind it, but it can help, and we have tons of data for fertility. But does post-cycle therapy work for men that are on TRT? So let's put the steroid users to the side right now because we don't even know about that. But so many men come to me even being on TRT. So what's the difference between TRT and steroid use? Dose. And for you guys who don't know that, they're using the same drugs, testosterone cypionate, enanthate, propionate, succinone 250, and instead of being on little baby doses that I talk about all the time, microdosing for testosterone replacement, they're on huge doses, double the dose, 10 times, even 100 times the dose. And that's steroid doses. So when you're on steroids versus TRT, now we see the difference is dose. Not to mention other drugs. When you're on steroids, you're adding tons of other drugs, steroids, and you're stacking them all together. So the way I want to approach this for you guys conceptually is looking at PCT for anabolic steroid users versus a guy in TRT. Think about a burning building. This is an example I use for my patients all the time. If you have a building that is 100 floors, it's burning, and you have to get out of that building. So say you're up on the 80th floor, and you need to get out of the building. If you jump from the 80th floor, you're not going to survive. Everyone knows it. But if you can get down somehow, down to the second, third, or maybe even the fourth floor, and you can jump and roll, you have a better chance of living. So my analogy is, and if you're up on the 80th floor, you're on tons of steroids, you're shut down significantly on the steroids, including big doses of TRT, testosterone, not TRT, and you need to bring yourself down to be able to get off and have your own natural system, hypothalamus pituitary gonad axis come back. Everyone knows it. And there's no data that PCT is going to help that. But if you're up so high, it's only ethical that you could use PCT to go down to a lower floor, jump and roll. You see? So now you're on the lower floor, you're on TRT, you're close to your baseline, you're shut down. Even tiny doses, even microdosing, even tiny 100 milligrams a week of testosterone is going to shut you down if you look at the LH and FSH gonadotropins. It's amazing. Testicles still can be atrophied, but depending on you, how long you've been on, other drugs, how old you are, what are the other medical issues you have.
If you're watching this video, I'm sure you're concerned for your testosterone levels. In addition to testosterone, you want to check sexually binding globulin, estradiol, free androgen index, and potentially cortisol. That's where I want to talk about today's sponsor, Let's Get Checked. They're a worldwide leader in at-home test kits, so you can get a comprehensive look at your testosterone levels and other labs without even leaving your home. You can order a test kit that will be delivered to you in discreet packaging. Once your sample arrives in the laboratory, confidential results will be available from your secure online account within 2 to 5 business days. These results are reviewed by a clinician, and a member of the Let's Get Checked nursing team may call you to review your results. Let's Get Checked laboratories are CLIA approved and CAP accredited, which are the highest ranking levels of accreditation for labs. So if you want to test your hormone levels without having to leave your home, visit trylgc.com.
But depending on you, how long you've been on, other drugs, how old you are, what are the other medical issues you have, you're on TRT, do you need PCT to get off? And so many guys have done it, and I never want to get annoyed at guys, but it kind of annoys me because I'm like, you're on TRT. Doc, I need some PCT. I want to get off testosterone. I'm on TRT, doc. No more steroids, but I need some PCT to get off TRT. And I'm like, years ago, I'd be like, wait a minute, let me think about this. So if we give HCG, tamoxifen, anti-estrogens, and Clomid and all these things, any combination, I don't care what combination it is, do you need it when you're on TRT? The answer is no. You're already low, stop the TRT. You could wean TRT, you could wean it down and then stop it. At a certain point, guys, you need your brain and your testicles to come back together to produce natural testosterone. So there it is, guys. I want you guys to enjoy that, and I want to see tons of comments. What do you guys know about this? Have you tried it? And if you do use PCT for TRT, what was your result? At what point are you completely off everything, natty, and your testicles are functioning, you're on endogenous testosterone, and you feel great? Do you feel great? How long does it last? Do you go back on TRT? Is it possible to use PCT for TRT? I don't think so, because I just don't see it's needed. Steroids, building, you're high up, need to come down, jump and roll. Thank you so much, guys, for this one. This is kind of a fun one. There's no data for this stuff, so I had to just kind of wing it for you guys with all my anecdotal experience. Let me hear from you now about this topic. Thank you so much, gentlemen.